Today, I'm talking about orgasms. What are they, and why do we have them, and how do we have better ones? Stay tuned for more. Hey everyone, welcome back to my channel. I'm Dr. Jennifer Lincoln, board-certified OBGYN, author, and educator, and my channel is the health class you wish you had in high school. If you're not already subscribed, go ahead and subscribe and hit the bell so you never miss an upload. Today's video is fun. It's about orgasms, and who doesn't love that? I'm going to talk about what they are, why we have them, how to have one, and most importantly maybe is what to do when you find that you can't have an orgasm or you're struggling with them. So let's get started. First things first, what is an orgasm? It is the peak experience of sexual pleasure. Basically, it's the climax of sexual assignment. In women and those who have a clitoris and a vagina, that is usually seen by full body tensing, actual contractions in the uterus and the vagina, and maybe even in the rectum. And then afterwards, sort of this feeling. And I do want to address, before you drop a comment or if you're confused, I will go back and forth between saying woman and person with a clitoris, person with a vagina. If that's confusing to you and you're wondering, why do I use that language? Go ahead and watch this quick video up here and it will answer all your questions. Okay, let's talk about orgasm statistics. I think this is really important, whether you are somebody who is trying to have an orgasm or you're trying to help your partner have an orgasm. When it comes to women and people who have a vagina, 80% of us require clitoral stimulation in order to have an orgasm. That means only about 20% of us are able to orgasm from penetrative vaginal sex. And have you seen my handy dandy video about the clitoris? Do you remember this old friend here? This is the clitoris. This is the part that you can see, and this is the part that flanks the vagina, kind of like that. So if you want to know more about it and the anatomy so that you can help have yourself a better orgasm or your partner, go ahead and watch this video right there. Why is this important to know? Because if you are trying to orgasm only by having penis and vagina sex and you're struggling, that might be why. Because you're normal, because you're part of the 80% of people who need that clitoris to be acknowledged in order to orgasm. Okay, so why do we have orgasms? It's not necessary for sexual pleasure. There are lots of people who don't orgasm and still find sex really fun and enjoyable and feel like it brings them closer with their partner. There's lots of theories out there about why we orgasm, and I'm not sure we really know the answer, but I think all of these sound somewhat reputable. And the bottom line here is that Mother Nature does nothing just for fun. So when people say, oh, the clitoris is there just to make us feel good. No, it's there to make us feel good, and also it helps when the clitoris gets stimulated to make the vagina more ready for sex. There's more lubrication, because at the end of the day, the goal of our bodies is to pass on our DNA. So it's nice that pleasure is part of that, but it's not just to feel good. So some researchers propose that we orgasm because it helps us feel closer with our partner. It helps us feel more excited about having sex and wanting to have sex again, so we're more likely to do it and, you guessed it, get pregnant and pass on our genes. Because evolutionarily, getting pregnant and giving birth is the most dangerous thing most of us can do. And as you know, back in the old days, people died all the time from childbirth. And still, even in the United States, and more especially worldwide, death from childbirth, unfortunately, still happens. There's also the theory that when we orgasm and the uterus contracts, it helps to suck up the sperm into the uterus and into the fallopian tubes to help with fertilization. There's not a ton of data objectively to support this, but it could make sense. The other reason could be, does it help us find a good partner? Meaning that if we can find a partner who can find our clitoris and make us feel good, then maybe there's somebody we should stick around with. And I'm thinking back to caveman days when we needed somebody who could be a good hunter. So if you can hunt and find our clitoris, then you can hunt and find food. When it comes to types of orgasms, there have been different types described, like clitoral orgasms, vaginal orgasms, even cervical or uterine orgasms, and even cooler orgasms from things like nipple stimulation. I don't really care what you call it or how many types there are. The bottom line is that we can orgasm from all sorts of different stimulation, and whatever feels good for you and helps you do that, that's awesome. For some people, orgasm is this buildup, and then this explosive release of energy. And for others, it's more of a slow burn, not a huge, big release of energy, but afterwards this feeling of peace and calmness and rest and closeness with your partner. Both of them are fine if they feel good to you and that's what you enjoy. Remember, what feels good to you is normal for you. Okay, how do we have more orgasms? And I think what's really cool is this Finland study. I will link it down in the show notes. But what they did is they wanted to find out, how do people have more orgasms? Now, you might think that the way that you have more orgasms is you masturbate more, so you know what feels good. You have sex with more people because you can kind of figure out what works for you. And in this study, they found that that actually wasn't true at all. What they found was that people who orgasmed more Those factors were more related to how they felt mentally and in their relationship, meaning feeling open enough to feel close to their partners, to feel respected by their partners, to be able to communicate what feels good. Those people were more likely to have more and better orgasms. Now, sure, technique definitely came into play, but it was more about feeling free of stress, being able to concentrate, things that are more about up here than down there when it comes to feeling good. So in a relationship where communication was open and the partners felt that they could be open with each other, tell them what they needed, those are the people who are more likely to have good orgasms. And I think that's really reassuring. I know you might want a textbook, like do this and then this and that, and your partner will love you forever. And of course, magazines and websites, they all have that stuff out there. And I'm not saying technique doesn't matter, but at the end of the day, so much of how we as women and people with a clitoris are able to peak and climax, it has to do with what's up here. So focus on that, my friends. So yes, when it comes to technique, of course, you need to understand what the clitoris is, and I showed that there, and stimulating that, and understanding that 80% of us need that touched in order to climax. But that's not the only thing. You may be wondering, what about the G-spot? And the thing is that the G-spot or the Grafenberg spot, it's still up for debate, meaning that we're not sure if it's a separate anatomic structure. But the idea is that if you reach into the vagina, a little bit here and do this kind of come hither motion, that there might be an area there that feels good for some people. And whether it's an anatomic spot or a collection of nerves, or maybe it's just an extension of what the clitoris is, who cares? If it feels good, by all means, go ahead and stimulate it. Okay, let's end on this last topic. What to do if you can't orgasm or your partner can't orgasm. And that has a medical term called anorgasmia. And it can be really frustrating for people and lead to a lot of relationship difficulties. And I understand it. I want you to know that when people come to us with this complaint, so often we want a magic pill or supplement or something that can, fix it all, make it all better. And unfortunately, that's often not the case and often won't work. And here's why. Because we have to figure out why you're having trouble with orgasms. And a lot of it, like I said, comes down to things that have nothing to do with your vagina or your clitoris. So we need to take a thorough history and understand, have you always not been able to orgasm, or is it just now? Is it with this partner? Are there life stresses going on? Are you on any new medications that may make orgasm difficult? For example, some antidepressants do have anorgasmia and libido issues as a side effect. Not all of them, and it's not a reason to avoid all of them if you need that treatment, but it is something important to keep in the back of your mind if you just started on one of them and now you're having trouble climaxing in the bedroom. Do you not feel safe with your partner, or feel like you can share your body with your partner and your desires, or are you feeling ashamed? And we know that society loves to shame us when it comes to being, sexual creatures in the bedroom. Do you have a past history of trauma or abuse that makes it hard to feel safe in the bedroom? That can absolutely affect your ability to climax. Do you not understand how your body works? If you've never seen your clitoris, touched yourself, or you've previously been yelled at or told that you're not supposed to do it, it's a sin or it's immoral, and that's going to make it a little trickier for you to know what feels good and communicate that to your partner. Have you had issues in the bedroom and now they keep compounding themselves, and so every time you have sex it feels really stressful and it's really hard and you're just worried? That can totally make it hard to orgasm. And what about your body? Are you scrolling through Instagram and TikTok, seeing what other people look like, but of course they're all using filters and all sorts of things, and thinking that your body isn't beautiful? That can definitely harm how you feel in the bedroom. Whatever the case is, if you partner with us, your OBGYN or your obstetric provider, we can help walk through these things. And sometimes treatments are a combination of sex therapy, couples therapy, pelvic floor physical therapy, figuring out what medications might need to be readjusted, all sorts of things, but we can help you. What questions do you have about orgasms? Go ahead and drop them in the comments. And if you're not following me on TikTok or Instagram, go ahead and do that at Dr. Jennifer Lincoln. And here's to feeling good, my friends, okay? No shame in that game. Until next time, bye-bye.